So kia ora, I'm Sarah Nicolson. I'm a specialist anaesthetist in Tāmaki Makaurau, Auckland. My hospital is Te Toka Tumai, it's Auckland City Hospital. And I've worked there for most of my specialty career, but I've worked all over Aotearoa, New Zealand as a trainee. It's an interesting one, isn't it? Because anaesthesia is not front and foremost when people think about medicine. I tend to start by asking their experience with anaesthesia because everyone's got a story, everyone's got an experience, everyone's been through it themselves or with family, and then I just base my discussions about anaesthesia on them. I think a lot of people still don't quite realise the role an anaesthetist has. My kids hear me ring my patients a few days before surgery. They hear me talk to them and listen to them and ask them questions. They hear me ring them in the days afterwards, but I think they still don't quite know that I'm there with a patient the whole way through their operation. Yeah, I try to get to know them. Like, they should be able to rely on me to have all my medical school training, all my specialty training. I think in Australia and New Zealand we train really good doctors and we've got great high standards. They should be able to rely on me to be prepared, to have lots of information, to practice crisis management, all the things that they shouldn't need to worry about. What I try to do is actually just listen to them, get to know them, ask them what's important to them, ask their whānau, so their family, the people who've come with them to surgery, because often when patients are so vulnerable, they're really scared, they're often very anxious about what they're about to go through. They forget to ask their questions. And so their family are often really good at saying, oh, you know, she doesn't like needles, or she faints, you know, he faints anytime he has a blood test. You know, all those things, just to get to know people. And then by listening and hearing what's important to them, it helps me help them make decisions about whether they want an operation or not, what type of pain relief might work best for them. And hopefully by sitting with them and listening, then they feel like they're in safe hands. It's years of training. It's building knowledge, skills, experience. We learn to look after patients from when they're little children right through to when they're very elderly, when they're quite frail. We learn to look after them for a range of operations. We readily update our knowledge and practice those crisis management that we need to be able to have there ready to go. You know, our patients just need to know that they've got someone beside them, that someone's there the whole time, watching them, looking after them, keeping them safe. Every day's different, and that's centred around the fact that every person is different. They come to their procedure, to their operation, with a different set of medical issues, but also a different history, a different family situation, and everyone's interesting to talk to. So it's just great. I get told off for chatting too much. It's just great getting to know these people. And then in theatre, we work in teams. So I work with wonderful healthcare professionals. They're all really skilled at their jobs, and we work really well in a team together, both during simple, maybe a bit boring procedures and really difficult ones. I think it's also good to pick your team depending on their music tastes. If someone's got a really good playlist, it makes a day go well. In New Zealand, it's really important that we look after people in communities that have not been well served by our health system. And I think FANZCA is really supportive at helping us manage people in a culturally safe way. In New Zealand, I'm really privileged to work with Māori and Pasifika doctors We've got some wonderful junior doctors coming through training who are Māori in Pacifica, and I hope that means for our Māori community, for our Pacific Island communities, that they see people treating them, looking after them, that they identify with.